Dementia, different from delirium. Dementia means your memory's gone. It means you don't register new memories. Very common, horrible, right? All the things worse for me, right? What of all the things I'm going to learn now? And then they're all going to fade away. I have seen things you people would never believe. I've seen ships on fire over Orion. But now all of those memories will be lost like teardrops in the rain. And that's what it is. Dementia makes it so all of your memories are lost like teardrops in the rain. Ooh. Now, so dementia, the first part about dementia is that dementia does not mean you can't do calculations. Calculations is the intellectual equivalent of like a knee-jerk reflex or spinal root ganglion. In other words, you go, hi, what's 97 minus 3? 94. What's 94 minus 3? 91. Okay. What did I just ask you? What do you mean? It doesn't affect registration. Registration means this. How you doing? Good to see you. Registration means this. Oh, I got it. What'd you just do? What do you mean? What did I do? Nothing. Did you just say hello to me? Sure, good to see you again. See, it's a good cover for not knowing anybody's name. Just walk up to people. Hey, good to see you again. Makes it feel good, and they don't even notice that they don't even know their name. Oh, by the way, one little thing there with the thymus, the thymectomy, in people who with myasthenia gravis, under 60, 70, 60, 70, its approximation book says 60, but it could be 60, 70, it's an approximation with that thymectomy. So the question about this is, there's no diagnostic test for Alzheimer's. So how far is it your responsibility to go? Well, your responsibility in the average demented person is to go as far as B12. And remember, you can have a normal hematologic findings of B12 deficiency. You could have normal hematologic findings of B12 deficiency. Your responsibility is to exclude thyroid problems, hypothyroidism. Your responsibility is to exclude syphilis. Your responsibility is to exclude syphilis with a VDRL or RPR. Your responsibility is to scan the brain. Your responsibility is not to do a lumbar puncture. Lumbar puncture is not necessary unless there's something in the history or physical in the question telling you. There is not a need to do a lumbar puncture unless there's something special. Now, there is no diagnostic test for Alzheimer's, and the treatment for Alzheimer's is all universally kind of crappy. Let's increase acetylcholine in our brain with donepezil or ribostigmine or galantamine, and all of these are identical, and all of them can cause diarrhea and salivation and a little bronchospasm. Because remember, acetylcholine and COPD can cause bronchospasm because acetylcholine constricts and secretes the lung. Constricts the bronchi and secretes into your lungs. Acetylcholine makes you constrict and secrete. Secrete and constrict. So all of these are exactly equal for Alzheimer's disease. We have memantine, which has a different mechanism, MDMA receptor, where it preserves cells. So you can use both of these. None of them is great, and none of them reverse Alzheimer's. They just improve it a little bit, but it's better, I suppose, than doing nothing. So how far do we have to go before we can say it's Alzheimer's? These tests, and then it's Alzheimer's, and it doesn't include a lumbar puncture. So let's look at some special circumstances. If I tell you that dementia is rapidly progressive, meaning a couple of months, not days. If it's days, there's no dementia that really happens over days. Rapidly dementia over a couple of months, whereas Alzheimer's is over years. Rapidly progressive dementia with myoclonus, abnormal muscle contraction. With myoclonus, abnormal spasmodic muscle contractions. Abnormal myoclonus with abnormal special muscle contractions. Myoclonus, rapidly progressive dementia in myoclonic jerks. Woohoo! Rapidly progressive dementia in myoclonic jerks. Oh yeah! Rapidly progressive dementia in myoclonic jerks. This is Creutzfeldt-Jakob disease. Not Jakob Creutzfeldt, but Creutzfeldt-Jakob. And Kreutzer Jakob, CT, LP, MRI, negative. Brain biopsy is the most accurate test, but I need a brain biopsy like I need a hole in my head. So now I have to give you something that you can find on cerebrospinal fluid. The normal parameters will not show anything. What I mean by that is the white cells will be normal, the protein will be normal, the normal parameters, the usual parameters of lumbar puncture will show nothing. What you can do on the cerebrospinal fluid is there's something called the 14-3-3 protein. The 14-3-3 protein on cerebrospinal fluid. And this is the association with the prions of Creutzfeldt-Jakob. No therapy with the prions of Creutzfeldt-Jakob. And the prions of Creutzfeldt-Jakob are associated with a 14-3-3 protein. And that 14-3-3 protein can spare you the need for a brain biopsy if you're looking at Creutzfeldt-Jakob syndrome. So there's no therapy, rapidly progressive dementia, myoclonic jerks. There is no unique physical finding except muscle spasms. There's no unique thing on a scan of the brain. Why can you get it? You can get it. Do you know that dementia is a contraindication to being an organ donor? You know that? If you have dementia, that means you can't be an organ donor because we're afraid of giving people Creutzfeldt-Jakob disease. All right, next one. The next one has very vivid hallucinations, very detailed hallucinations, vivid hallucinations, very precise, very detailed, and some Parkinson's type disease. Very detailed. What happened to you? How did you end up on the floor of your room? Two men named John and Frank showed up at my office at 3 o'clock in the morning. They drove in a blue Toyota pickup truck. They lifted me out of my bed and put me on the ground. Yeah, except you're in a nursing home and there hasn't been anybody here. But very vivid hallucination. Very vivid hallucinations is Lewy body dementia, and you treat the Parkinsonism and with Parkinson's drugs and the dementia drugs like donepezil, ribostigmine, and galantamine. Oh, I'm wet. I'm wacky. I'm wobbly. I'm wet. I'm wacky. I'm wobbly. I'm wet. I have urine incontinence. I'm wacky. I have dementia. I'm wobbly. I have gait ataxia. I'm wet, wacky, and wobbly, and gait ataxia, and we have normal pressure hydrocephalus. Normal pressure hydrocephalus, which will be seen on a scan. We see it on a scan, and it's one of the reasons that we do CT scans for everybody who've got dementia, and you can shunt it. Shunty, 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 shunty. Nah, wet, wacky, and wobbly. No, next one. Oh, it is emotional lability. Your happies are too happy. Your sads are too sad. Your angries are too angry. You've got a choreiform movement disorder and dementia and emotional disturbance, choreiform movement disorder in dementia, with dementia, and that's Huntington's. Huntington's disease. Huntington's disease. Remember, that's the CAG trinucleotide repeat. Okay, that's the diagnostic test. And remember that drug you never heard of before? Here it is, and you still haven't heard of it. Tetrabenazine for the movement disorder of Huntington's disease. So the diagnosis, what's the most likely diagnosis question, is the most frequently asked question for dementia. You have to be able to recognize the other dementia syndromes like multi-infarct dementia, which is also called vascular dementia. One of the things that we don't know is that in stroke, with a stepwise decrease, is that 40% of people who have strokes develop dementia because it cooks off part of your brain. 40% because it kills off part of the brain each time you have a stroke. The same way that the most common cause of systolic dysfunction, congestive failure, is myocardial infarction. It's myocardial infarction. It kills off part of the heart Well, the heart doesn't move and you have a decreased ejection fraction. Stroke kills off part of the brain and you have a decreased IQ fraction, a decreased emotional fraction, a decreased intellectual fraction. Dementia. Oh, what happens when you start going out and shave only one half of your face? You walk around with your fly unzipped all the time? You don't bathe, you put your underwear on the outside of your pants, and you're not a superhero. Social appropriate lost first, then memory, then memory. This is lobar dementia, also known as Pick's disease, also known as frontotemporal dementia. Pick's disease, lobar atrophy, or frontal temporal dementia. And it's lobar, meaning when you scan the brain, you'll see just some parts of the brain damaged. So you actually see it, pieces of the brain damaged more than others on the scan of the brain. There's no treatment for Pick's disease, for lobar atrophy, also known as frontotemporal dementia. So what do you got to do to be able to say somebody has Alzheimer's? You exclude hypothyroidism, you exclude low B12, you exclude neurosyphilis, you don't have to go as far as an LP, and you only have to go looking for Creutzfeldt-Jakob if it tells you rapidly progressive dementia and myoclonic jerks. You only have to go after Lewy body dementia if they tell you vivid hallucinations and Parkinsonism. You only have to go after Huntington's if they tell you emotional chorea, emotionally labile choreans. Okay? CAG, trinucleotide, repeat sequences. Dementia is not a long section, but you have to know what's different about each one of them so you can answer what's the most likely diagnosis. The treatment's not really satisfying. We're screwed on the dementia story. We just don't know what happens with it. It's like osteoarthritis of your brain, but you can't just replace this joint. It's sad, really. See you in the next section.